Osteoporosis is a disease which affects the bone. There will be loss of bone mass and hence increased risk of fracture. This is the picture of osteoporotic bone and normal bone. The left side bone is the normal one and the right side is bone affected with osteoporosis. When the bone is magnified, it looks like this. You can easily see the density of the bone. Osteoporotic bone are less dense and are more prone for fractures. This is the picture of femur bone, healthy bone, and osteoporotic bone. The primary cause of osteoporosis is more common form and is due to the typical age-related loss of bone from skeleton. After post-menopause, due to decrease in estrogen or testosterone deficiency and inability to produce adequate vitamin D3, decrease in bone formation. Secondary cause include results from the presence of other diseases or conditions that predispose to bone loss, medications, hyperparathyroidism, excess use of alcohol, and smoking. Non-adherence to exercise is also considered as a cause. Sedentary lifestyle is also a cause, as sedentary lifestyle decreases the density of the bone, which results in loss of bone in later years. Osteoporosis can be prevented by doing weight-bearing exercise like skipping. Weight training should be inculcated in exercise regimen. Healthy and balanced diet and keeping away from substance abuse. I would like to add here that vitamin D is also very essential for bone health. Vitamin D helps in the formation, in the absorption of calcium from food. Vitamin D is formed in our body when our body is exposed to sunlight. Even if we take calcium-rich food, if our body is deficient in vitamin D, it will not absorb the calcium from the food into our bones. Exercise such as skipping increases the bone density of legs. Weight training at least twice a week improves the density of the bones involved in weight training. The management of osteoporosis, medical consultation and adherence to medicines, dietary changes, you have to take in more calcium rich food, do strength training, balance training, posture training, flexibility training and weight bearing aerobic activity. Choose exercise that are appropriate for your fitness level, abilities and health. As osteoporosis usually affect older people, exercise should be carefully and appropriately planned. For strength training, one can do exercise with one's own body weight like push-ups, leg raises, squats. One can also exercise with external weight like in a gymnasium. While doing external weights, care must be taken and there should be someone to help you out. One should start all the exercise in a milder form and slowly increase the intensity and frequency of exercise. Exercise at least 2 days a week. These are some of the exercise for balance training. Reducing your base of support, that is standing on one leg instead of two, walking on your toes or on your heels, walking in unusual pattern, for example heel to toe walking in a line, figure of 8 walking and walking backwards will also develop balancing ability. You can also shift weight to the limits of support, that is moving your weight more to one foot than another by responding to a disturbance, for example correcting your balance after being thrown off balance by something, and also performing strength training exercise that challenge your balance like lunges. Your posture can be corrected by balancing your weight evenly on both feet. You have to gently draw the belly in to prevent lordosis. Gently tuck your chin in forming right angle to neck. Draw your chest up slightly. And while sitting, sit erect with support for your lower back. Like a small pillow you can keep, or a supportive chair will be enough. Coming to flexibility training, try including lunges in training program, or try including some longer strides or steps in your daily walk. For the muscle around the ankle, try to do Vajrasana. Perform back bending and front bending asanas with advice from doctor. Stand in Tadasana and stretch the entire body up. Weight bearing aerobic activity also help in osteoporosis. Activities such as walking, aerobic dance and stair climbing are best. Swimming and cycling are aerobic activity, but remember, it is not weight bearing aerobic activity. Choose an activity as per your liking and convenience. It will help you to continue with the activity for a longer time. Wear proper shoes to minimize the force on knee joint. Always do warm up and cool down. Start with 10 minutes of activity and gradually, very gradually increase up to 30 minutes. So I hope this section is clear. Thank you very much.